Nagaland governor threatens to evoke Article 371A(1)(b) of the Constitution of India in Nagaland, writes a letter to Chief Minister saying the scenario in the state is grim and that law and order has collapsed. Total positive cases of COVID-19 in Nagaland surged to 355 with 8 new cases of the virus reported from Kohima and Dimapur. State's Health and Family Welfare Minister says the new cases were reported out of 316 samples tested. And total lockdown enforced in Mon district from today after a police constable posted for duty at a quarantine center starts showing COVID-19 symptoms. Contact tracing is on to find out every person that Jawan came in with. Well, hello viewers, welcome to News and Trends, and you're watching the daily news broadcast that's coming to you from our studios here in Nagaland. We begin with the latest update on the letter addressed to the Chief Minister of Nagaland by the state governor. Nagaland's governor R.N. Ravi has threatened to evoke Article 371A(1)(b) of the Constitution of India in view of what he termed as a grim scenario in the state. In a letter to Chief Minister Nefirio, the governor said that the scenario in the state is grim and that law and order has collapsed. The letter stated that the constitutional established state government is being challenged on day-to-day basis by the armed gang who question the sovereignty and integrity of the nation, while the instruments of law and order remain totally unresponsive. In such a backdrop, Ravi said he can no longer abstain from his constitutional obligations for law and order in the state and under Article 371A(1)(b) of the Constitution of India. He also proposed that hereafter important law and order decisions like transfer and posting of officials entrusted with maintenance of law and order responsibilities of and above the district level will be after the approval of the governor. I also propose to periodically review the law and order in the state and issue required lawful directions. In order to instill and ensure accountability, I also prefer to review the annual performance appraisal reports of all such officers, the governor said. Ravi said he had been closely observing the precarious law and order situation in the state with lots of concern ever since August 2019, since he took over the constitutional chair of the state. He added that the day-to-day unrestrained depredations by over a dozen organized armed gang brazenly running their respective so-called governments, challenging the legitimacy of the state government without any resistance from the law and order machinery, has created a crisis of confidence in the system. He said rampant extortions and violence by armed gangs has taken toll on Naga people. The governor said the situation has deteriorated to such an extent that the armed miscreants appoint their own dealers for every commodity coming into the state, adding that miscreants run syndicates including contrabands and alcoholic drinks. Steady downslide in all the parameters of development in Nagaland, example road connectivity, health and education infrastructure and livelihood, are attributed to siphoning off a large chunk of the government funds meant for development. He further said a significant reason for such leakage is attributed to institutional systematic ransom to armed gangs. Ravi disclosed that during periodic monitoring of the progress of construction of national highways, the NHIDCL and the project contractors complained of the armed gangs stopping the work unless 5 to 7% of the project cost is given to them as ransom. There were also instances of kidnapping and assault on project engineers and managers for defiance or delay in ransom payment. Ravi said he has told the Chief Minister and senior officers to act against miscreants and restore rule of law. I have been raising the concern in almost all our formal and informal meetings with you and the law and order officials. However, I regret to say my urgings and advices at the political and bureaucratic levels have gone unheeded, he said. Total positive cases of COVID-19 in Nagaland surged to 355 with 8 new cases of the virus reported from Kohima and Dimapur. Informing this in a tweet this morning, State's Health and Family Welfare Minister Espangi Pom said, 8 new cases of COVID-19 positive have been reported out of the 316 samples tested. 5 patients from Kohima Quarantine Center and 3 from Dimapur Quarantine Center. The minister also tweeted to inform that 12 more patients have recovered from COVID-19, 8 from Dimapur, 2 from Kohima and 2 from Perin. With 160 recoveries, active cases now stand at 195. According to Nagaland's COVID-19 dashboard, the top districts and number of positive cases are Perin 161, Dimapur 57, Mon 48, Kohima 26 and others 18. According to Nagaland's COVID-19 dashboard, the overnight increase of 8 cases to 355, the growth factor stands at 0.47. It also said 2.53% of 316 samples were tested positive, and the percentage difference in tests per day decreased from 44 to 29%. Meanwhile, 5 frontline workers in Dimapur and Kohima have tested positive of COVID-19. Informing this at a press briefing, Health and Family Welfare Principal Director Dr. Vizula Sokre said that the 5 included 4 bus drivers in Kohima and Dimapur quarantine centers. 2 of them tested positive on June 23 and 2 on June 25, and a receptionist at Naga Hospital Authority Kohima. In this regard, health officials have activated contact tracing in Kohima. Upper PWD colony was sealed today afternoon for contact tracing since the employee of NHAK is a resident of that colony. A total lockdown has been enforced in Mon district from today after a police constable under District Executive Force DEF posted for duty at a quarantine center started showing COVID-19 symptoms. According to sources, the patient had fever, body ache as well as headache, and a TrueNat test of the swab sample collected from the constable returned positive yesterday evening. Sources also informed that the constable had come in contact with others during the last few days, and as a result, the total lockdown was initiated to contain the possible spread of the virus. The lockdown order passed by the Deputy Commissioner yesterday stated that the district will be under total lockdown from June 25 to June 28. Movement of public has been strictly prohibited except on medical emergencies. All shops except pharmacies will remain closed and movement of private vehicles have been strictly prohibited. The Deputy Commissioner added that the lockdown will continue till next week if needed. Contact tracing is on to find out every person the Jawan came in contact with, and until each one of them is tested, the lockdown will be in force, he said. India registered its worst single-day increase in COVID-19 cases today, recording more than 16,000 coronavirus infections to push the overall tally to 4.73 lakh, the Union Health Ministry said. This was the 6th consecutive day when coronavirus cases increased by more than 14,000. The Health Ministry data updated at 8 a.m. this morning showed the daily tally increased by the highest ever 16,922 cases to reach 4,73,105. However, according to the data, the recovery rate has improved to 57.43%. The number of active cases stand at 1,86,514, while 2,71,696 people have recovered. One patient has migrated. Maharashtra has reported the highest number of cases, followed by Delhi, Tamil Nadu, Gujarat, Uttar Pradesh, Rajasthan and West Bengal, according to the ministry data. In the northeast, Assam has reported 6,198 cases of the pathogen. A total of 1,259 cases have been reported from Tripura. Manipur has 970 COVID-19 cases. Mizoram has 142. Arunachal Pradesh has 158. Meghalaya 46. And Sikkim has reported 84 cases till now. The total number of global coronavirus has increased to 94,24,000, while the death toll has reached 4,82,580 according to the Johns Hopkins University, with 23,80,490 confirmed cases and 1,21,969 deaths. The US currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 11,88,631 infections and 53,830 deaths. The other countries with over 10,000 deaths are the UK, Italy, France, Spain, Mexico and India. APC and Dimapur in charge of COVID-19 activities, along with the Deputy Commissioner Dimapur Anup Kimchi and Commissioner of Police Dimapur Rotihu Tetsio, today visited the institutional quarantine center at Ganesh Nagar and interacted with the senior officers who are taking in charge of the quarantine center, and also visited the rooms and areas where the returnees are being kept. He said Dimapur alone has 51 institutional quarantine centers and 25 paid institutional quarantine centers, a mammoth total of 76, out of which Ganesh Nagar is the biggest in terms of the number of beds. Kekhetosema stated that due to the overwhelming number of returnees, testing is being delayed, which has resulted in the number of days in the institutional quarantine being stretched, some even up to 25 to 28 days. He also stated that to err is human and no one is perfect, and as stated earlier, COVID-19 not being a common syllabus, every person is learning every day. Thus, whatever issues or problems might have come up in the quarantine centers, both on the part of the frontline workers, medical unit, security personnel, as well as the inmates of the quarantine centers, should be amicably resolved. He said that there have been daily incidences in the quarantine centers with infighting among the inmates, causing personal injury as well as destruction to properties in the centers, which have never found their way in the social media. This is because the frontline workers and the administration are well aware of the desperation and frustration the returnees or the inmates will be facing in various ways, and understands that not everything that happens should be put in the public domain for dissection by every public. However, any error on the part of the frontline workers or the administration immediately finds their way in the social media, and the government and all frontliners are minced at the table of the social media. He therefore requested the inmates of the quarantine centers to be patient with the administration and frontline workers also, and always try to resolve issues in a peaceful manner, assuring that most of the inmates in the Ganesh Nagar quarantine center who are Bengaluru returnees will be released latest by this week, as most of the testing has been completed. He expressed hope that community spread can be contained in Nagaland. He appreciated the police officers and personnel who have been entrusted to look after the quarantine center, and also stressed upon the need for patience and tolerance amongst the security and the inmates. The Christian Institute of Health Sciences and Research, in collaboration with Chumugidima Circle Task Force on COVID-19, conducted a community COVID training at Chumugidima Town Council Hall today. EAC Chumugidima Tejavizo Nakro, who also welcomed the gathering, in his keynote address said that though the state is still in stage 2, the training program for community leaders was initiated to impart facts and precautionary measures of COVID-19 pandemic, keeping in mind the potential of community spread. He urged the gathering to strictly follow all the safety protocol issued by the government to contain the spread of COVID-19. Head of Anesthesiology Department, CIHSR, Dr. Adharu Moses, gave the introduction of COVID, explained in detail how COVID spread. Reminding the gathering not to panic, he said that among the positive cases, 81 are known to be asymptomatic, and 14% moderate, and only 5% were known to be severe cases. People above 65 years of age, diabetic, heart problems, and immunocompromised were known to be vulnerable group. He said that in mild cases, hospitalization were required, as only moderate to severe and vulnerable groups need hospitalization and may take 3 to 6 weeks to recover. He also briefed the gathering the precautionary measures while taking care of a COVID positive person. Infection Control Department, CIHSR, Thi Senyo, spoke on information, education and communication, while clinical psychologist CIHSR Imli Bendla also chaired the training program, spoke on psychological care. Village Council Chairman, head GBs, women leaders and youth leaders from different villages and wards under Chomukadima attended the training program. Hand washing facilities and hand sanitizers were provided outside the hall for all the trainees, and they were also seen seated at a distance from each other, maintaining social distancing and precautionary measures. Now, we at News and Trends would like to inform all the parents of school children below the age of 10 that we are organizing a video message competition for all the kids to keep them busy while their schools are shut. All you have to do is to let your kids take part in this competition to express the views, opinions, and appreciation to all the frontline workers in the fight against COVID-19. Prizes will be awarded to the first and the second prizes along with 3 consolation prizes. For all details, you can visit our Facebook page, News and Trends from Nagaland. All you have to do is shoot the video message on your mobile phones and send them to the WhatsApp number 6909864232 along with their name, age, male or female, school, class, place, etc. The last date for entry is 1st of July 2020. Do visit our Facebook page, News and Trends from Nagaland, for all the details. That's all we have time for in this edition of News Broadcast. But before we leave you, here's another reminder that you can send in your videos to let us know what's happening in your village, your district, your town, or your locality, so that we can show your videos to the rest of the viewers watching this broadcast. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.